Alright, so this is my method for taking a psychiatric intake history. I specifically designed this to allow me to hit all the points that are covered in a CSE or a clinical skills examination. In this box, I do my introduction, explaining my role, that I'm a resident doctor, and then also any confidentiality limits. So I must report child abuse, elder abuse, suicidal ideation, homicidal ideation. And then in this box, if it's not a CSV, I'll put some information from my chart review, what medications they're on, when their last visit was, who that doctor was. And then in this box is where I do the review of systems, and I'll further subdivide it into 6 squares. I have an acronym, always perform my most amazing projects, and this stands for ADHD, PTSD, MDD, mania or screening for bipolar disorders, anxiety, and psychosis. This just triggers me to ask some screener questions for each of these, and if those are positive, then to go further in depth. This is where I cover my psychiatric history. I draw a little picture of a hospital here to remind me that this is about hospitalizations, suicide attempts, self-harm, and then past diagnoses, past psychiatric medications they've tried, and then past treatment, what therapy they've done. And then down in this box, I just have another acronym that I use to take a basic medical history. It's dusty muffler shakes, hood always squeaks furiously. It's like an old car. So dusty is for diagnoses, they have hypertension or whatever. Muffler is for medications, so medications they are currently taking. Shakes is for seizures. Have you ever had a seizure? Dusty muffler shakes. Hood, that's for head trauma. Have you ever hit your head so bad that you had to see a doctor or lost consciousness? And then always, it's allergies. Squeaks, that's surgeries. And then furiously, that's their family history of psychiatric illness. And then here, I'll take a developmental history and a social history. So I draw this little arrow here for developmental. Any problems when your mother was pregnant with you? Do you need an IEP in school, et cetera, et cetera? What's the highest degree of education you've obtained? Then I'll draw a house. Ask them about firearms at home, who they live with, if they're safe at home. And then the last one is a social history. Do you use nicotine, tobacco, alcohol, drugs? Are you sexually active? And then down here, I'll put my mental status exam. For the CSE, you specifically have to ask about mood, SI, HI, auditory and visual hallucinations. And then here, I'll keep some thoughts about my assessment and plan as I'm going through. If I want to make notes about maybe an extra screener I need to do here, like a McLean if I think they might have borderline personality disorder. And that's that.